Well, good evening, everyone, and thanks for coming to the National Vet Tech Week webinar with NAFTA. My name is Lori Davin, and again, thank you and happy Vet Tech Week to all of you. Thank you for what you do. We love you. We appreciate you. Our animals love you. So our topic tonight is self-care for vet techs, which I'm sure you all need. Good pedicure, manicure, right? So that's what we're going to do for you tonight here. Our speaker tonight is Dr. Amanda Landis-Hanna, and our sponsor tonight is Merrick Animal Health. Thank you to Merrick Animal Health, and thank you, Dr. Amanda Landis-Hanna. Few housekeeping rules. First, we would like you to hold your Q&As till the end. You can put your questions in, but please make sure you put them into the Q&A and not the chat. It can kind of get lost in the chat if other people start chatting. So if you truly have a question, please put it into the Q&A. Our race approval for tonight is also still pending, so I will keep everybody informed about what's going on with that, but that should be happening soon for your certificates. Everybody will be muted, so we don't hear any background noise. This is a 1-hour session, and it's being recorded also. So let me just give some information here on our speaker tonight. Dr. Amanda Landis-Hanna is Vice President for Veterinarians at Heel House Call Veterinarian. She has practiced small animal and exotic medicine, shelter medicine, relief, and house call medicine. And she's worked in both private practice and corporate practice over the last 19 years. She has worked in research and industry, helping develop and test a first-in-class biometric monitoring system in telemedicine. She has presented at numerous conferences, including VMX, WVC, ACVIM, and AVMA convention, as well as many veterinarian colleges. She has completed her human-animal bond certification, as well as fear-free. Her passions include mobile veterinarian medicine, improving access to veterinarian care, reducing barriers to veterinarian care within diverse communities, increasing research and educational opportunities with veterinary medicine, the human-animal bond, and mental health within the animal care industry. So welcome, Dr. Amanda Landis-Hanna.
Hi, everybody. Thank you so much for having me. We're going to go ahead and get kicked off. Again, happy Veterinary Technician Week. I certainly am a big believer that I could not do what I do without the technicians that I know and love supporting me. And for that, I'm very, very grateful. And let's see if I can get my slide to flip. Thank you also to our sponsor, Merck Animal Health. Again, quick reminder, please use the Q&A and not the chat for questions. Feel free to use the chat for comments, but if you've got questions for me, we're going to be following along the Q&A. I'd hate to miss any questions. So today we're going to go through self-care for veterinary technicians. Again, this is me. I am a working mom. So if you see a small child flying behind me or a dog climbs into my lap, I apologize. This is life in the Zoom world. Hopefully we can all be a little compassionate with each other. I am the Vice President for Veterinarians at Heel House Call Veterinarian. I also have chronic anxiety and chronic pain. And the reason why I'm very upfront with you guys about that is because the stuff that we're going to be talking about today is all part of what I have used as part of my therapeutic treatment plan over the last 10, 15, 20 years of my career and of my life. I am not a psychologist or psychiatrist. I am not a licensed clinical therapist. I am a person who has experienced a lot of licensed clinical therapy. And so I'm going to be sharing some comments as well as some experiences with you guys. But certainly I want you to keep in mind that these are coming from my experiences and from the research. This is not necessarily a direct recommendation to any one person. I always recommend having your own therapeutic relationships. And there's some great resources that I'll mention along the way tonight. So before we get much further, let's go ahead and do our poll. We have a poll that Lori is going to launch. It's just got a couple of questions, but it's going to give us an idea of who it is that we're working with tonight, who's in the room, what your experiences have been with self-care, as well as what may be preventing you from experiencing self-care currently. And Lori, if you want to pop on once that poll is complete and let us all know, that would be great.
Okay, it looks like I can go ahead and end it, and it should let me share it on the screen.
Okay.
So let's
Let me know if I need to stop sharing long enough for that.
we should be able to. So does everyone see that up there? The results?
Yes. Okay, great. So what I'm seeing here is that most people in the majority of the poll for how often you feel stressed on a work day, we're talking about greater than 50% of your time. If we take into account the 75 to 100% of the time, we've got a very strong majority of people are feeling significant stress during their work day. When we are thinking about reasons why people don't currently practice self-care, we have a number of different answers. Feeling guilty for taking time for me. This is one that I'm personally super familiar with, and I'm going to give you guys some information around why you shouldn't feel guilty. And I also see that we've got a lot of people responding to or more of the above, which is that they don't really know if it'll help and don't really know what to do. I'm going to show you guys some research that's going to help to support that. What happens when you're feeling stressed? Looks like we've got plenty of people that are feeling their emotions more strongly than usual, including feeling more angry. Shorter temper with colleagues or clients. That's something that I personally experienced a lot of when I was in practice. I have one of my former veterinary technicians actually on this call this evening. And if I was ever short with you, Malia, I apologize very belatedly. And then favorite ways to relax. Okay, I'm seeing some guilty pleasures, snuggling with furry and feathered friends. I see a lot of people have an interest in doing something healthy, and that's really one of our best options. So we're going to talk through that. The guilty pleasures, while we may consider them guilty pleasures and maybe not being quite as significant as far as causing any kind of negative or detrimental effects, it can actually have some detrimental effects. So we're going to go through those different pieces as well. So I'm going to go back and make sure that we can all get back to the main screen. Okay. And Lori, do you see the buzzword self-care slide?
Yes.
Okay.
Good.
So on we go. So everyone's heard about self-care. Lots of people think it might be a little indulgent. It might be something that is for everybody else. I don't know about you guys, but I'm notorious for recommending self-care to people and then maybe not participating in it myself. As a working mom, I frequently feel guilty or feel like I don't even have enough time to do, something as normal as making a bathroom break, as opposed to even getting in a manicure or pedicure, although that would be nice too. So let's talk about what self-care is and what it is not. First and foremost, it is not selfish, it is not entitlement, and it is not lazy. No person who is taking time to take a step back or take a deep breath is doing it out of a need to be selfish or lazy. In fact, those are things that people need to do in order to survive. What we're really talking about today are basic survival skills that we've kind of lost sight of, especially in relationship to things like recent overworking of our veterinary teams, as well as the COVID pandemic and the impact that that has had on a variety of us in our practice lives. According to the Oxford dictionaries, self-care is to preserve or improve one's health. That's it. There is no word lazy in that. There is no word selfish in that. That is just to preserve or improve one's health. And so I want you guys to consider and take in, as we're going through this presentation tonight, what can you do to preserve or improve one's health? What can you do on a daily basis that may not take much time or energy, but just might give you a little breath of relief? So those are the types of things that we're going to be talking about tonight. It can be yoga, but it does not have to be yoga. Yoga is the one thing that everyone immediately thinks of, or at least I've always had suggested to me. Maybe it's because I've got chronic anxiety. Maybe it's because I've got chronic pain, but everyone always comes to me and says, have you tried yoga? And the answer to that is yes, I have, numerous times. But here's a fun little self-care bingo and some ideas that you guys can take a look at for things that perhaps you don't really consider being self-care. In a clinic, some of the really great things that you can do to help provide some self-care are setting boundaries around things like gossip or complaining. It's really easy to get swept up in a very frustrating day and give in to the need to gossip or to complain, myself included. I fell victim to this a lot. And what you'll wind up finding is that the research supports that people that frequently gossip or complain, they're actually more predisposed to have a worse mental health situation than people that abstain from those behaviors. And maybe it's not you, maybe it's one of the other technicians that you work with or someone in the front desk team that really has a predisposition towards complaining. Those are the people to try and avoid as much as possible, at least when they're in those kinds of foul moods where they're going to be propagating those types of behaviors. Here's another big one, eating regularly. When I was practicing full-time as a VCA medical director, regular meals were pretty short and they didn't happen very often, but I always carried a granola bar so I could at least get something into my stomach. The one that was really tricky for me was taking regular bathroom breaks. I'm sure that probably some people are snickering and may actually know exactly what I'm talking about. But sometimes taking time away from the clients and the patients, even if it's just for a few minutes to run to the restroom, that not only is going to improve your quality of life, but it's a basic bodily function. You have every right to be able to go to the restroom when you need to. Outside of the clinic, what are some things that you can do? Certainly getting some exercise or going for a walk can be great. Now that can be, say for instance, during a shorter lunch break, if you have an opportunity to do so. I used to split my lunch break between actually eating some food and going for a short walk, just because I needed to get out of the physical space of the brick and mortar practice. Sometimes it's important to also set boundaries, not just with people that you work with, but also with your family and with your friends. It's important that you are able to set those boundaries and hold to them, because that's a way of being kind to yourself. It might not feel kind to the person that you're telling, okay, I don't have as much time for you right now in this moment, but perhaps I can follow up with you later on in the day. But we need to be able to set those boundaries and maintain them in an effort to try and make sure that we are getting what we need in order to survive on a daily basis. That does include things like sleep. So for those of you who feel like self-care is staying up late night binging on TV, Netflix, Hulu, I might have done this once or twice. If you're a late night binger, it's important to keep in mind that what is a healthier response is actually to get sleep instead of late night binging. But there is a time and a place for a little bit of TV as well. So do you guys see these kinds of images pop up in your Facebook or in your Pinterest feeds? Maybe I'm the only person who still uses Pinterest like an addict, but I love these types of checklists. I feel like usually by the time we get to the end of the season, I've only checked off one or two of those. So it might be a fun challenge to take a look at something like one of these autumn fall checklists and maybe try and check off 2 or 3 or more and see if you can experience something new that you haven't had a chance to experience before. Okay, so here's where my geekiness comes out. And I should have put in the very first slide that I am a notorious nerd and I love it. So you're going to have to listen to me talk for a couple minutes about some of the neurotransmitters that come into play when we're talking about different aspects of self-care. One that we're very familiar with is serotonin. In fact, there's a relatively new song out that my husband pointed out to me. I hadn't heard it until he pointed it out to me yesterday, but it's actually called the Serotonin Song. Serotonin is a really key factor in how good we feel as individuals. It's a hormone that stabilizes our mood, and it does help to provide feelings of well-being and contentment, as well as happiness. So that's a really important neurotransmitter to have circulating in your system, as well as dopamine. Dopamine is another neurotransmitter, and it plays a big role in how we feel pleasure. Sometimes if we're talking about someone who may be taking antidepressants or anti-anxiety medications, a lot of times it's going to impact the serotonin and the dopamine levels that are circulating in your bloodstream. And the goal here is to get more dopamine and more serotonin so that you have the opportunity to truly feel better. Dopamine is also really key in how we're able to create neural pathways in order to plan for events or for things that may be coming up in the future. A third neurotransmitter, and this one cracks me up a little bit just because you can see how complex the organic structure of oxytocin is when compared to the more basic setups for serotonin and for dopamine. But oxytocin is a hormone that we're very familiar with when it comes to lactation and birthing. But what a lot of people don't realize is that it's actually really associated with things like building of empathy and trust. It also increases in times of sexual activity and relationship building. So this is a hormone, it's called the love hormone. This particular neurotransmitter can help not only to create a sense of well-being and belonging, but it can also help to increase a sense of love and even joy within our biologic systems. So why is self-care important? Self-care has a lot of different important aspects to it, and it's not just to make us feel better, although I, for one, am all for all of you feeling better as much as you possibly can. But what I wanted to talk about here is what happens when we don't provide self-care. You know, if we go back to that Oxford Dictionary description, it really talks about improving one's own health and improving one's behavioral health as well. But what happens if we don't practice self-care? We can actually see a breakdown in how our brains are working, from being something where we're very loaded in the prefrontal cortex, or this forward part of our brain, to being much more limbic based, so much more back in our lizard brain where our amygdala is functioning. Now, when we're in our prefrontal cortex aspect of our brain, we're having higher thought function, we're able to collect and retain memories, we're able to help create new neural pathways for new ways of thinking. Whereas if we're in our limbic brain, where we're working more from our amygdala, we're working in a situation where we aren't creating new neural pathways. Instead, we're really functioning out of a place of adrenal response and neurochemical response. So as opposed to being proactive, and we can be proactive in our prefrontal cortex, we're very much reactionary or reactive when we're working back in our limbic brain. Another method to kind of get an idea of what the brain looks like and how this works is to take your thumb and place your thumb in the middle of your hand and then wrap your fingers over it. This lower part of your brain, the more reptilian part of your brain, is your amygdala and your limbic system. And then the top part of your brain is your prefrontal cortex. So sometimes you may hear someone even refer to popping off or getting your prefrontal cortex disengaged, and now you're just working in that limbic brain system. This is where fight, flight, or freeze really lives. So in situations where you may have a very strong adrenal response to a particular exposure or a particular environmental aspect that you're experiencing, you may experience that fight, flight, or freeze here in that limbic aspect of your brain. And in that case, what your body is trying to do and what your brain is trying to do is merely survive. It's not around for any of this higher thinking that you get up here with your prefrontal cortex. Instead, what it's really aimed at is survival. So that's why I'm asking the question of where is the saber-toothed tiger and what is the saber-toothed tiger? If you're in a very limbic brain aspect and you're really trying to function with just surviving, think about prehistoric times when we might have had a very large, aggressive, carnivorous mammal hunting us. And that's when our limbic brain was at its best, was trying to protect us from something that might be attacking us or we might be experiencing. Well, now here in a first world country, we don't really have things attacking us very frequently, but we feel and we respond as if something as severe as a saber-toothed tiger attack is still occurring. So what I mean by that is you might read on the news that Costco is having a toilet paper shortage, and your brain may go to a very limbic response where you're not really able to engage that more higher level thinking with this prefrontal cortex. Instead, with self-care, what you're able to do is actually take a step back from that model and take a step back away from any immediate fight, flight, or freeze. Take a deep breath and assess whether you really are functioning in this limbic brain, or if you're able to instead engage that prefrontal cortex and say, okay, a toilet paper shortage is inconvenient, but it's not the same thing as an animal attacking me at this point in time. So I want to speak a little bit to neurodiversity here as well. In situations where we have neurodiversity, we can have a variety of different people's brains who are structurally the same, but who may have different functions. So certainly when we think about neurodiversity, we think about Asperger's as well as autism spectrum. But it's important to keep in mind that there are other spectrums as well that can have impact and can be related to other brains through neurodiversity. One that I personally experience and I live with is this anxiety and depression spectrum, where some of the ways that my brain works may not be quite the same as, say, for instance, another human being that doesn't have anxiety or depression. Again, in my case, my particular brain, it's at a heightened state of agitation due to my chronic anxiety. So that means that I'm already very frequently keyed up and in my limbic brain. And so it takes more effort for me to engage my prefrontal cortex in order to really be present and in the moment and realize that there is not, in fact, a saber-toothed tiger chasing after me. Other types of spectrum disorders or spectrum abilities include things like a highly sensitive personality. Individuals with highly sensitive personality really feel emotions on a very big scale. So they don't just feel, say, for instance, happy or sad the way that someone who doesn't experience highly sensitive personality may experience. Instead, they feel very, very, very happy or very, very, very sad. It's also related to empathy. And we all know a natural empath who starts to really absorb other people's energies and can then take that energy and can start to feel it themselves. So a good example here is if someone's having a really bad day, an empath is going to talk to them, try and find out what's going on, and may actually begin to feel that same sense of what's going wrong in their physical body. So these are ways that different brains work. There's no problem with any of them. Everybody's brain is individual and beautiful. But everybody's brain, because of the individuality, may mean that they're more predisposed towards needing additional self-care to engage that prefrontal cortex and get out of that more limbic system. Here's where I'm going to remind you guys that self-care is self-care, and we really can't rely on other people to help encourage us to find the time or find the need for self-care. a big one with this one is busyness is a social status. For a lot of us, we have been trained that the busier we are, the more productive we are, therefore the better we are as a human being and a better contributor we are to society. And I'm actually going to pump the brakes on that and let you know that a shame researcher by the name of Brene Brown, she actually has disproven this in that being busy, while it may be a social status, it is not actually an indicator of how valuable a person is or how worthwhile a person is within society. So sometimes we appear busy and we propagate that busyness, but it doesn't actually help improve our health, well-being, or our worthiness within the community. In fact, it can be detrimental to our health, well-being, and our benefits within the community and within society as a whole. This is where it's really important to set up some basic boundaries for some time of self-care. It might be 5 minutes before bed. It might be 5 minutes in the morning. It might be taking your lunch break every day. But it's important to find some intrinsic value in being able to really identify that self-care is truly taking care of oneself. Yes, it's great if our bosses and our teammates can see the benefit of it, but even if they don't, it's our responsibility to truly act on creation of some self-care boundaries so that we're able to access what we need in order to have our best health and best mental health as well. So here's a question that I sometimes get. Can self-care be harmful? And the answer is yes and no. So self-care is really anything that we're doing to improve our health and well-being. But what some people view as doing self-care is actually detrimental, meaning it's not beneficial, and therefore it is truly not self-care. It may just be a negative coping skill. Negative coping skills do exist for a reason. They have served some purpose at some point in time in the past or met some need for you at some time in the past. And therefore it can become a habit. Again, it's a negative coping skill, and it's a skill that can be practiced. Now, sometimes that can be practiced in a very negative way, and it can have negative impacts on our lives and our relationships. Here you'll see a list, and this is not a fully inclusive list, but you'll see a list of some negative coping skills that you may have experienced or may have even tried out in your own time to see if some of these things may be beneficial. But what I'll remind you is that these are not self-care. Self-care is improving your health and your mental health. These are negative coping skills. Some of these negative coping skills are truly socially accepted. So things like drinking, medicating, self-harm via exhaustion, meaning you work so hard or you do so much that you're completely exhausted. Well, the people that you're caring for think that that's great, but they don't necessarily recognize that it's a form of self-harm in that you're wearing yourself down so much that you're unable to care for yourself. Food is a big one. A lot of people eat socially or have what they consider comfort foods. And that's not to say that all comfort foods are bad, but when they are overused or abused, they can be bad. Shopping is another one, as well as scrolling. So everyone has this handy dandy little telephone device. And how often do we use it as a telephone? We don't. We actually scroll through, and you can even see here on mine, I have a million notifications. And by scrolling through, it's a way to numb our brain and disengage from what we're currently feeling. In any state, a little bit is okay, but it's very easy for more stress to add on and for some of these more socially accepted negative coping skills to get out of control. And when they get out of control, that's when we're dealing with addiction. Now, I want to be very clear. Addiction is an inability to stop using a substance or stop engaging in a behavior that's causing psychological and physical harm. This is according to the DSM-5, and this is the psychological manual that the American Psychiatric Association uses. So this is the actual true definition of addiction. Now, You can have an excessive appetite for something or have repetitive behaviors, but it not be an addiction. So an example there might be scrolling or numbing, meaning that you aren't developing a tolerance to scrolling or numbing. You aren't developing a compulsion where you have a total loss of control, excuse me. And you may or may not experience withdrawal as well. So even though something may not be a true addiction, say for instance, in the same sense that alcoholism or drug addiction exists, it may be something that is poorly controlled and can certainly cause some additional issues. Therefore, when I talk about addiction, I'm using the general terminology of addiction as well as excessive appetite or repetitive behaviors. So seeking help. How do you get help when you've got a negative or when you need help with a positive? Seeking help for negative behaviors, there's a lot of resources that are available to you. And obviously this is not the purpose of this self-care talk, but I did want you to be aware that if you took a look at that negative coping skills sheet and you realize that you have more than one negative coping skill that you currently rely on, there is professional help that's available to help you. There's also group organizations like CODA, which is Codependence Anonymous, AA, Alcoholics Anonymous, NA, Narcotics Anonymous. There's also programs like smoking cessation programs. There's medications that can help with that as well. Additionally, you can rely on your community and your friends. And if you're not sure about additional resources, it's always great to Google, say, for instance, part of what your negative coping skills may look like. So you can Google, say, for instance, cessation of binge eating, and you'll be able to find additional resources for that. Now, what about building self-care behaviors? It's great to have somebody that can help you when you're discontinuing a negative behavior, but what about building positive behaviors? This is where actually building and using a community can be very advantageous, because again, if we go back to how our neurotransmitters work, oxytocin in particular is one that really strengthens or boosts in times of utilizing community. So if you think about how we can engage with our family and friends, we're actually going to not only get support from our family and friends for some of these positive self-care behaviors, we'll actually get an oxytocin boost at the same time. So it's kind of a twofer. Same thing with accessing community resources or even a community gym. You're going to get a bump in your dopamine because you're planning, when am I going to go to the gym? What am I going to do while I'm there? How can I engage with my community? And so you'll get a bump in your dopamine while you're additionally getting extra resources to help support you while you're starting down the pathway of some positive self-care behaviors. Here's the question that a lot of people that have a little bit of OCD, and I do have a little bit of OCD, ask me. How do I know if I'm doing it right? Well, it's important to keep in mind that for a lot of us, what we're really looking at is coming in from a place of self-judgment. We assume we're doing something wrong until someone else tells us we're doing it right, instead of looking at it from a place of self-acceptance and self-compassion to say, how do I feel? Do I feel better when I'm participating in some of these positive activities? Again, some of those positive activities may be as simple and as straightforward as taking a restroom break, or it might be as complex as calling up a friend that you haven't had a chance to chat with in a while. So it's important to keep in mind that you can have truly positive feelings, get a bump in all of your neurotransmitters, your serotonin, your dopamine, and your oxytocin, while showing some self-compassion in the assumption that you're doing it right until somebody or something feels bad. If you feel badly, then you're not doing self-care right, but there's a good chance that you could do it better. And that's where additional resources such as professional help can be beneficial too. So here's a couple of ideas for self-care that you may not have thought of. Again, yoga is not on this list here, but you'll see it, don't worry. And one of the best quotes, one of the best comments that I ever got from working with a therapist was, what did you love to do when you were 9? when you were 9 years old and you didn't have the responsibilities of working in a clinic or trying to maintain the insanity of the rest of your team, or you didn't have a family to take care of, what did you love to do then? Because frequently what you loved to do when you were 9 is something that you will continue to love to do and can be a great resource for you for self-care. I'm going to pick on equine therapy because that is what I loved to do when I was 9. I loved horses. I loved everything about horses. So now I actually do participate in equine therapy. I have a horse that if I ride, great, that's fabulous. But if all I do is groom and just spend quality time with that horse, that's beneficial. There's a ton of great research that's available through the Human Animal Bond Research Institute, HABRI. If you go to habri.org, you'll see all of the great research on human and horse interactions and how beneficial that is to mental health as well as physical health. Other things that you may have enjoyed doing when you were 9, writing short stories or poetry. Again, it's not for publication. You don't have to publish anything, but it's to give your brain a creative outlet in order to allow it to express itself. If you're spending all day in a clinic and you're in a very left brain sort of capacity where you're doing tasks and you're completing lab work, you need to give that right brain an opportunity to stretch and flourish as well, or else you can have that sense of imbalance, and that really can start to create a detriment towards that concept of self-care. Baking is a big one because it's slow and methodical, and because it is very cathartic, and of course you get a delicious treat at the end, can be something that's very beneficial, as well as swimming. Swimming's great because it does not require any impact on the joints, and because you are flowing in that water, you have an opportunity to experience a greater sense of flow. Therefore, it can be a really great tool for self-care. There's even a type of therapy called float therapy, where you're enclosed in a float tank that's filled with salt water. So you float, hence float therapy. But it's it's set up in a way such that it's very quiet and you don't have a lot of other sounds or sights. Usually it's a very dark environment. And so it just allows your brain to relax and experience what it feels like to be in a state of self-care. Now, here's some granola and hippie stuff that I have tried, and I will preface this with, I am a hippie, so I have had some experiences with all of these. Yoga, because it is a mind-body experience, it is actually quite beneficial from a self-care perspective, but it doesn't have to be yoga. If you're very not interested in yoga, it definitely does not have to be yoga that you're participating in from a self-care perspective, but it's important to keep in mind that it does work and there's research that supports it. Sound therapy is another concept that you can do. With sound therapy, one of the ways that I've experienced it is sitting in a quiet room and having someone playing a meditative bell, like one of the bells that you see here, and riding and listening to that sound while it rides out, meaning you listen to it from the initial intonation all the way through when that tone discontinues. And that allows you to be very mindful and present and in the moment. Affirmations are also great. There's some really solid research that helps to support that affirmations can be a very positive way to engage, not only with your prefrontal cortex, but it can also be a way of calling down what you are seeking from the universe. So you get a chance to really reaffirm within your own brain what it is that you're hopeful for. And for those that choose to believe in this particular pathway, it can also be a way to call down from the universe via law of attraction what it is that you're actively seeking. There's a lot of great apps that have affirmations available, and that's going to be I'm going to have those listed for you on the last pages of this particular deck. Crystal therapy, I've experienced it. I can't say that I've had much of an impact for it, so I'm not going to speak highly or lowly of it. But energy work or Reiki is another type of healing modality and self-care that a lot of people really speak to. There's an increase in the amount of research around Reiki, or transfer of energy, and it's spelled R-E-I-K-I. If you're interested in researching more about Reiki or other energy healing modalities. So I've just given you guys a whole bunch of different options and a whole lot to think about. So where do I start? Where I want you to start is with baby steps. I don't want you to feel overwhelmed. I don't want you to start thinking about, oh my God, am I increasing my oxytocin right now at this moment? Instead, I want you to think about baby steps. For instance, other than taking a bathroom break, what can you do in a 5-minute time frame? You can snuggle a patient. Say that you're restraining them if somebody's being grouchy, but you can snuggle on a patient. And you can also take deep breaths. And by deep breaths, I want you to consider belly breathing. So you can certainly Google belly breathing or box, B-O-X breathing. Those are different breathing techniques that can help to engage your diaphragm. So when you're taking that deep breath, you want it to be a very belly heavy breath, and you want your diaphragm to move, because that's going to help stimulate your parasympathetic nervous system to turn off your fight or flight, but actually to turn on your rest and digest system, your parasympathetic nervous system. Also in 5 minutes, you can take a look at some quotes and affirmations. Again, I mentioned that I had some apps that I really like. Here's a listing of a couple of apps that I use. And these slides will be available to you guys if you want them. You'll just need to email us and let us know that you're interested in seeing the slides. Meditation is great, especially if you have a 10-minute time frame. Again, I like to use apps. Currently, my favorite is Calm, but I also love Insight Timer and Headspace. Headspace also has some really cute graphics online that you can look up on YouTube. And those are little cartoons that explain the benefits of meditation in a way that even I can understand it. It took me a while to understand the benefits, but it only takes 10 minutes and it can create a lot more space and presence for you. If you have 20 minutes, so a shorter lunch break, you can take a walk outside, you can identify some birds and look at trees. Being in nature is actually really well researched to be able to improve the mental health of the participant. So it's definitely something that I would encourage. If you can get outside, even if it's just for a couple minutes, even if it's on a rainy day, that's going to be beneficial to spend even a little bit of time in nature. And if you have a whole 30 minutes, which to me feels like this big luxurious thing, and you need to be able to spend a little bit of time outside of the practice, you can take a car nap, or you can definitely consider looking up autonomous sensory meridian response audio. If you type in ASMR audio into a Google Drive, into a Google box, you're going to be able to find a lot of really great audio that's very soothing, and it helps to create a sense of almost brain melt, where you've got that sense of your brain starting to sort of unwind and relax a little bit more. So what are the most important parts of all of this? The most important parts are gratitude and feeling it. So how do you experience gratitude when you do have a couple minutes for self-care? How do you document that in a way that you're able to re-experience that later on in the day? How does your body feel? Are you journaling about your gratitude, about every moment that you get for self-care, or are you just letting it pass on by? It's really important to sit and to truly feel those feelings, because then you're able to recollect them later on in the day when things are really stressful. It's important not to numb feeling good, meaning when you're feeling good, you don't want to say, I'm feeling pretty good right now, let me zone out on my phone. No, if you're feeling good, it's important to sit in that moment and to cherish that moment and to have gratitude in that moment, so that you're able to recollect that at a later point in time when you might not be feeling quite as good. Again, when you sit and you experience and you are contemplating experiencing these positive feelings, you're increasing your dopamine, your oxytocin, and your serotonin. So you're actually creating positive neural pathways that will help you further down the road as well as help you in the immediate self-care perspective. Okay, I flew through a ton of information, including some research and some nerdy science, but I do want you to know that I fully believe that each of you can do this. You've got my contact information, my cell phone, my email. If you have questions, I'm going to definitely be looking at the Q&A here in just a minute, so feel free to pop in any questions that you may have. But if you need some additional support or some additional resources, you can also feel free to reach out to me, and I'm happy to provide those. Some of the teachers that I mentioned, or some of their reflections that I mentioned, include Brene Brown, Gretchen Rubin, Tara Brock, and Rick Hansen. And so these may be good people to look up, or look up their research if you're interested in getting some additional information. And I'm going to leave that slide up, and I will stop sharing.
Yes, if anyone has any questions, now's the time to put them in the Q&A for us. I would like to thank you, Dr. Amanda Landis-Hanna and Merck Animal Health, for your world of expertise tonight. I actually wrote a lot of things down that I want to try, and I truly believe self-care, everything you talked about was just so spot on. So thank you so much. I really appreciate it, and I think all the vet techs really appreciate that too.
Absolutely. I'm very happy to be here and very happy to help. Again, happy to answer any questions or give any other particular examples if that would be useful. And I just want to say to Cassandra, I'm really glad that you also love Pinterest, because I love Pinterest too. And Sherry, yes, you're absolutely going to be able to get a copy of the slides. If you just want to throw your email into the chat thread, or email NAVTA, you'll be able to get a copy of the slides.
And if you just want to email them to me, I can go ahead and get them out to everybody that attended.
Sure.
So just
thank you, Lori.
Reach out to me at NAVTA. You guys have my email address, and I can just send them to everybody once I get them. So
you just gave me a little boost of oxytocin. Thank you for that.
You're welcome. Well, I don't see any questions. I'm not sure if people are typing and trying to get them in, but I don't see any questions yet. Just a lot in the chat.
Sherry, I'm going to type it here in the chat box. The organization that holds all the research about the human-animal bond is called HABRI, and the website is habri.org.
And someone's asking, the horse organization with mental health. Okay, that's what you just gave.
So that's where the research lies.
Well, you're getting a lot of thank yous. So
thank you guys so much for coming and for participating. Hopefully I presented some new information for you and gave you a couple of little incremental bits. Remember, even a bathroom break is self-care, and you deserve it. And it is a legal requirement. So by all means, take it. Even when you don't feel like you have enough time to do it, take a deep breath and say, oh, Dr. Amanda said I should go to the bathroom. I should go to the bathroom.
Right. Even when you're working from home, there's some days I don't do that. I'm like, whoa, I need to walk away. Well, if everybody there, again, thank you for joining us tonight. I hope you all took something away, and thank you all of that techs. Have a great week, and we'll see you again next month.
Yep. Happy Vet Tech Week.
Thanks, everyone. Have a good evening. Bye.
Bye-bye.